Greetings. I'm Chris Alpi from the Icahn School of Medicine at Mount Sinai, and I'm here on behalf of my co-authors and our larger team to update you on our resource sharing research. At this conference back in 2020, we shared our plan to study the impact of the COVID-19 pandemic on interlibrary loan and document delivery in health sciences libraries. 4 years later, we are back to report on what we learned. First, our research team refined questions about the early pandemic timeframe of March to August 2020 that would benefit from looking across multiple institutions. We broke into teams based on the study designs and the data we hoped to use. We published our plan so that others would know what we were doing. We started with a survey, and the final question of the survey asked what other questions the community would like to see us address. The secondary data team obtained aggregated data from DOCLINE for our participating team libraries to be able to compare with overall DOCLINE fill rates. Last, a primary data team focused on reasons for unfilled requests and looked at monographs and other content not typically borrowed through DOCLINE, as well as looking at document delivery. To strengthen our conclusions for both the secondary and the primary data studies, we included a historical comparison with 2019 data. Completing 3 interdependent studies took longer than we anticipated. It was almost 4 years from planning until the final article was submitted. 7 of our 12 team members had a career or personal life change during that time. We especially thank those who took on a more extensive role as a team coordinator during one or more stages of the project. Now I want to share a little bit about each of the studies and what we learned about collaborative research. If you are based at one of the 431 health sciences libraries in North America that participated in our survey, thank you. The survey addressed staffing, operational practices, and policy decisions. The findings are open access in the Journal of the Medical Library Association cited below. We reported numerical data, examined how certain responses were associated with others, and whether differences seen were statistically significant. Our thematic analysis on the open-ended questions included issues we expected and things we hadn't anticipated. One thing we learned about the research is that surveys can always be improved. We revised this survey 4 times and still got feedback from respondents about unclear questions. For the secondary data study, we wanted to look at whether the perception that more items went unfilled during the pandemic was supported by data. We also wanted to know about the age and subject matter of materials that were unfilled and assess whether those items were digitally available to inform collection development. This was published open access in Issues in Science and Technology Librarianship. We learned that working with third parties can take more time upfront for data use permissions. It also adds complexity because you're working with their system data fields, and you may need to adapt your questions to what they can make available or further manipulate their data. We used a free tool called OpenRefine, which was already familiar to some members of our research team. The primary data team wanted to understand their reasons for unfilled borrowing and lending requests, primarily for monographs. We also had questions about document delivery. This publication has been submitted, but is under review. For this project, we did the work ourselves to combine data from our participating team libraries that used ILLiad. Thank you to Summer Steele from Oregon Health and Science University Library, who helped write the guidance that standardized the ILLiad reports we requested. Even with stock reporting, we saw that rejection reasons and practices, as well as what constitutes document delivery, varied among our libraries. In summary, we learned that ILL remains an incredibly important service. Almost all requests we examined in both time periods were for unique items requested a single time across all libraries. An area ripe for further study are the financial impacts. At the time of the survey, many respondents could not answer our cost-related questions. We don't know whether cost decreased as a reason for unfilled requests because borrowing libraries increased their max costs, or that the increase in other reasons for unfilled requests meant that items weren't available regardless of willingness to pay. Surprisingly, very little was common among the participating libraries, although all were health sciences libraries serving similar academic programs. Finally, the publication process for multiple related studies was challenging. We were surprised by feedback that one article on this topic of resource sharing in health libraries was sufficient, and that our follow-up studies research questions may have been too narrow in scope to appeal to most audiences. On behalf of our entire research team, thank you for attending our lightning talk. We appreciate your interest. We also appreciate the gift of time from all library staff who participated in our research. Please connect through the conference app or email me if you have any questions. Thank you.